Hello everyone, this is going to be the first video of week 5. We're going to have an introduction into the skin and wounds. We're going to first discuss the functions of the skin. One function is protection. This acts as a barrier to water, microorganisms, and damaging ultraviolet rays from the sun. It can protect us against infections. It can protect us against injury to the underlying tissues and organs. Another function is temperature regulation. It is a psychosocial function as it contributes to the external appearance. It also provides sensation, provides the sense of touch, pain, pressure, and temperatures. It also helps with the vitamin D production. This is activated by the ultraviolet rays from the sun. It helps produce vitamin D. Immunologic, it triggers immunologic responses when it's broken. Absorption, absorbs substances such as medication when needed. And elimination, it helps excrete small amounts of water's electrolytes in the sweat. We also need to look at some risk factors for skin alterations. What places people at risk for skin alterations? First is age. We are going to talk about that in just a little bit. Second is their lifestyle. Do they have HIV or AIDS, which decreases the immune response? Do they have prolonged exposure to the sun, which can put them at risk for skin cancers? Do they have a lot of body piercings? Because all these are portals for infection. What is their health state? Do they stay hydrated? Are they malnourished? Health state can also include the reduced sensation. Are they able to sense temperature extremes, pressure, friction? Do they know they've had an injury? We're also going to look at illnesses such as diabetes, which decreases the healing process. Also, therapeutic measures. This would be bed rest. If you're bed rest, it predisposes the patient to skin breakdown, such as pressure wounds. Do they have casts? This can irritate the skin. We need to make sure we're covering the rough edges. Watching for aquathermia units. This is beneficial, but we need to make sure that we follow the protocol for the length of the application. We need to look at medications. Prolonged use of steroids can cause thinning of the skin. We also need to look for allergic reactions. And lastly, radiation therapy, which can cause erythema, which is reddening of the skin. This can also lead to skin breakdown. Okay, we're going to finish up this lecture with factors and prevention for the older persons with skin risk. We're going to talk about what puts the elder generation at higher risk for skin breakdown. First, we're going to talk about the subcutaneous and the dermal skin. This becomes thin as we age, which increases the risk for the skin to easily become injured. They have more wrinkles, which decreases their skin turgor. They have reduced sensation. The sweat glands decrease. The skin becomes drier. Elderlies do not bathe daily because that can dry out the skin even more. We're going to apply lotions. We're going to encourage adequate hydration to help with those sweat glands decreasing. The cell renewal decreases as well, which decreases healing time. The melanocyte cells that make the pigment, the color of our hair and our skin decline. So that's why the hair becomes gray and white. You develop dark spots. We need to watch for melanoma. The collagen fiber is less organized, which means the skin loses elasticity. We are going to check the skin frequently for tears, irritation, and breakdown.